men are responsible for a significant amount of couples infertility, or how much are the guys responsible for in general, and what do you do to evaluate that? I think you mentioned earlier, but let's just do a quick review of that.
So male factor infertility accounts for about 30%, about a third of infertility that we see. Usually when, this is diagnosed on a semen analysis. So a semen analysis is the first test for a man to do. We look at three things: quantity of sperm. So how many millions of sperm do you have in that sample? Because yes, men make millions of sperm every day. Motility of that sperm. So how are the tails moving? And morphology of the sperm. How are the heads shaped? Because the heads have to be shaped a certain way and the tails moving a certain way to be able to penetrate an egg. So if we see that any of those parameters are off, the first thing we do is just repeat the semen analysis, right? Because sometimes it's just a fluke. We want to make sure that you haven't ejaculated in 2 to 3 days. So, and a lot of things can affect sperm, like if you're sick, if you have a cold, if you're tired, if you drink too much the night before. I mean, all these things can affect sperm. So we always do 2 studies if the first one isn't good. And in my patients, if they have low parameters, I usually send them to a reproductive urologist. And what usually those male reproductive urologists do is they do a testicular ultrasound. They do hormonal profiles. Is it a process going on in their brain that they're not making the right hormones that are telling the testicles to make sperm? Or is it a process on the level of the testicle where they're just not making sperm? So those urologists usually do a hormone profile, and they also do a genetic profile. So a lot of times men have very, very low sperm counts because there's deletions in the Y chromosome. So a chromosome, women have 46 chromosomes with 2 X's, and men have an X and a Y. And it's that Y chromosome that tells a man's body basically to make sperm. So you can have abnormalities in that chromosome, and a urologist would be able to, and we send that testing sometimes up front so that the urologist will have it, but it's important to test for those. They're called microdeletions.
Is it true that after ejaculation that it's better for the woman to kind of like elevate her hips, or like lie on her, like kind of like get her hips above her head kind of thing, to have the ejaculate stay inside her vagina?
There's no data to support that, putting your hips up or your legs up or any of that is going to help. Sperm is actually so fast, and it's to the tubes in about 5 minutes or so. But there's no risk to it, right? I wouldn't wait longer than 10 or 15 minutes after intercourse, because then you're going to end up potentially with a urinary tract infection if you don't empty your bladder, which is a whole other discussion. But resting there for 10 minutes or 15 minutes isn't gonna hurt anything, certainly.